Hello, my name is Dr. George Rogu from AdoptionDoctors.com. Today I'd like to speak to you a little bit about the post-adoption medical examination. In the U.S., generalized routine laboratory screening tests for healthy children is not the standard of care. However, in the internationally adopted child, extensive screening tests are performed for a multitude of reasons. These screening tests are recommended by the Pediatric Red Book of Infectious Diseases and by the American Academy of Pediatrics. It is only through extensive laboratory testing that a physician may uncover medical conditions that have not yet presented itself clinically, rule out diagnosis or conditions that were reported on the pre-adoption evaluation report, or help to confirm the adequacy of treatment of particular ailments that are documented as cured. Some parents feel that maybe they do not need to test their children because they had some blood work performed by the orphanage and that the child was already seen by a physician in order to qualify for a visa. While these are all good things to have done prior to your child arriving to the United States, it is not enough. The visa medical examination focuses primarily on detecting if a certain serious conditions or diseases that are contagious exist, thus making them ineligible for entry into the United States. The procedure usually consists of a very brief physical and medical history, a chest x-ray performed to look out for active tuberculosis. Some blood tests are performed to screen for HIV and syphilis. These tests are performed in the child that is older than 15 years of age, and in those younger than 15 years of age, they are only performed if there is a suspicion of a medical condition. Chances are that since the child really has no available history and there is little or no testing performed, that the visa examination consisted of documenting that the child is breathing at the moment of the examination and it is not terribly ill with any contagious disease. As for testing in the orphanages, caution should be used when interpreting the results. While these tests are important in the pre-adoption evaluation process, in order to help the family to make their decision, the validity of these tests needs to be confirmed, and they should only be considered as screening tools. Confirmation of the medical diagnosis should never be made solely on these test results. Because there's a wide variation in the geographic regions where the children are placed for international adoptions, different medical problems can be encountered in different regions. Screening is also important because of unknown medical backgrounds of the child, inadequacy of health care, and poor living conditions encountered in the institutional care setting. A physician should see an internationally adopted child within 2 weeks of the arrival to the United States. A child who is ill upon arrival with either an acute or chronic medical condition should be evaluated for that problem immediately. After the arrival of the child, this is a very good time for the parents to get to know one another with the child. The process of attachment and bonding needs to progress. Some parents may feel the need to have large family gatherings and parties, go on elaborate vacations to Disneyland, and buy everything at Toys R Us for the child. While their intentions are good, this will only overstimulate the child and stress them out. Just like these painless examples, an immediate visit to the doctor's office, multiple visits to the blood laboratory to get another type of excursion that does not need to be immediately used unless the child is acutely ill. Too much love is no good either. In the initial post-adoption evaluation, the following tests will include a thorough review of the child's medical history and concerns, a complete physical exam, evaluation and of the developmental milestones. Immunization status needs to be evaluated and confirmed with vaccination titers. There is no harm to have the child receive extra vaccines, but there may be harm if the child remains susceptible to childhood illness. The doctor will use the same catch-up schedule that would be used if the child was born in the United States and behind on vaccines. Elaborate laboratory screenings for multiple concerns. I would like to try to explain each test in general. A complete blood count gives us information on the status of the child's blood cells pertaining to anemia, which can cause by a multitude of reasons: sickle cell, thalassemia, anemia, chronic disease, or just simple iron deficiency anemia. A lead screen can cause anemia and developmental delays if untreated. Lead can be found in all institutional walls, in the water supply pipes, and overall environment as a pollutant. G6PD deficiency is an enzyme deficiency that is common in Asia, Africa, and in the Mediterranean regions. Screening for these tests needs to be performed prior to medications that may cause hemolytic anemia in persons lacking this enzyme. Children need a hemoglobin electrophoresis, especially in Asian children, to look for thalassemia. An HIV ELISA test tests for AIDS or HIV virus, a VDRL for syphilis, which is often transmitted from the mother to the child. A hepatitis B panel should be performed prior to the hepatitis B vaccination. If the test for acute and chronic disease as well as the vaccine status. Hepatitis C checks for hepatitis C, calcium phosphorus alkaline phosphatase, screens for rickets. A urinalysis checks the overall kidney functions. A stool sample for different intestinal parasites such as Giardia, which is very common in institutions. Stool cultures for intestinal bacteria. A comprehensive metabolic panel will check the overall body functions, liver, and the kidneys. TFTs or thyroid disease, a PPD for tuberculosis. Immunization statuses need to be checked to see if the child mounted an immune response to the vaccine schedule that was presented, and if not, we need to restart. We should do a state newborn screen in children are less than 12 months of age to check for different metabolic disorders. These are routinely tested at birth in the United States. A hearing and a vision screen needs to be done. As you can see, there's going to be a lot of blood drawn in order to perform these tests. It is a stressful time for both the child and for the parent. I generally recommend that the parents to perform these tests on 2 visits, spread out by 1 week apart. Thank you very much.